I'm Carrie. I'm one of the PGY1 ophthalmology residents here at Vanderbilt.
Hi, I'm Nicole. I'm another PGY1.
Hey guys, I'm Russell. I'm one of the ophthalmology interns.
Hi guys, I'm Nkechi Wabwaze. I am one of the PGY1s.
Hey guys, my name is Elise. I'm one of the PGY1s.
And we're here to talk about a little bit how our PGY1 year is structured here at Vanderbilt.
So as a PGY1, you are doing a general surgery year, which a lot of people get nervous about, but there's a lot of really great things about it. You end up doing 13 rotations, and in those rotations you get 4 months of ophthalmology.
So this month I'm on ophthalmology, which is great. Hanging out with the consult team, which is a good opportunity to learn ophthalmology before you start your residency.
You can do the consult service where you are seeing the patients that come into the emergency department where ophthalmology is consulted, and you see all of the inpatients. This is a really great exposure to see the difference between clinic and then the more acute setting. So it's a really great experience for us here. We are a level 1 trauma center, so we see a lot of great cases, and we've had a lot of excellent learning opportunities.
I'm currently on consult and I'm on clinic at the VA, which you can tell by the apparatus behind me. The typical day for an intern, you wake up, you go to conferences virtual because of coronavirus, and then clinic starting around 8:30, lasting around from 4 to 5. It's pretty nice as a PGY1 because you don't have the same pressure to see patients fast and to get them in and out. You really get to focus on learning ophthalmology, learning about your patients, and just expanding your knowledge. And it's always really good because you're able to ask your seniors and your attending any questions that you might have about a patient. And I think that's super good for the beginning of your training.
Also do surgical oncology, plastic surgery, burn ICU, VA SICU, ped surgery, VA clinic, neurosurgery, emergency department.
So it's really helpful because you get a wide variety of exposure to some of these surgical subspecialties, which helps you when you go into ophthalmology, a little bit of background for, in evaluating patients from a surgical standpoint, which is a really great benefit.
Currently on my pediatric surgery rotation. For this rotation, you spend 1 week doing something different. So this week I'm on nights, which is a lot of fun. It's busy. You see traumas, but you also kind of see the whole gamut. Last week I was in clinic, so I became a pro on diagnosing different hernias. And then the next few weeks I'll be in the OR and doing consults. So a little bit of everything.
Right now I'm on plastic surgery, which I think is a great rotation for people doing ophthalmology because we do a lot of face call. So seeing a lot of patients that have like orbital floor fractures and things like that, and just kind of seeing it from the other side, not just from the ophthalmology side, which is a really great experience.
And of course, my favorite thing about doing my PGY1 year at Vanderbilt is being able to do so much, so many months of ophthalmology. We get 3 or 4 months of ophthalmology during our prelim year. We're on the surgery months. I still think it's valuable because you get to make a lot of friends who are not necessarily in ophthalmology, but it'll be the people that will be consulting you for the next couple of years.
My favorite part is that you get to be on service with 3 other different interns from different surgical specialties. So making friends with people on Gen Surg, ENT, and Ortho, which is awesome.
One of the things I love about ophthalmology residency here is all of the great co-residents that I have. Starting off even as an intern, you get to meet a bunch of surgical subspecialty, interns, as well as anesthesia and plenty more that are really great and can be friends throughout the rest of residency. And then obviously my co-residents, specifically in ophthalmology, are amazing. All of the upper levels are great teachers, always getting you involved.
And just to bounce off of that, the faculty here are also very fun to work with. They're great teachers.
I went to Vanderbilt for med school and decided to stay here, and I don't regret that decision one bit.
Thanks for tuning in and listening to us talk about our program here.
We're really excited to meet you virtually. Please feel free to reach out if you have any questions. Good luck with the rest of your interview season.
Really hope you join us next year.